I'm Professor Uppelman, and I'm here to talk about tracheostomy care, on a non-disposable inner cannula. So that means that the cannula that's inserted into the patient's trach is removable, it needs cleaned and replaced back in. It cannot be thrown away, non-disposable. So the supplies we need is a tracheostomy care kit. This has all the supplies necessary to clean the in your cannula before putting it back in. You need hydrogen peroxide and sterile water. I also have a new trach tie. These are nice because they are Velcro and they're padded. There's also an actual tie in this trach care kit. So the first thing you're gonna do is check your order. Now, trach care is once a shift for sure, or as needed, PRN. So you're gonna look at your order, you're gonna check your patient's armband. When you walk in, you wash your hands, you introduce yourself. I'm Taylor, I'm gonna be doing trach care today. Mrs. Smith, tell me your name and your birthday. And you always check their armband at the same time. So patients who have trachs are very used to getting trach care. They usually can say what they like or don't like if they're able to talk with their trach. You do want to have your patient in semi-Fowler's position. So we're going to position her into semi-Fowler's or full Fowler's, but at least a 45-degree angle. You can see her trach here. She's got a trach tie in place. You always want to have it tied on one side during trach care to ensure that it doesn't become dislodged during trach care. She also has fenestrated gauze in place. We're going to replace that. There's a new one in the kit. You never want to cut a piece of gauze. You only want to use one that is already pre-cut. So I'm going to, and this is a sterile procedure, by the way. So we're going to get sterile, and then we're going to go ahead and clean around the stoma, the actual inner cannula, and then replace the tie. So first thing is we're going to open our kit. The inside of this is sterile, and gloves are included. So I'm gonna go ahead and get my gloves on. Now these are not placed in here as nice and neatly as some of our other sterile glove packages. So you need to be really careful with that first glove before you get sterile. We'll just go ahead and put that on and see if we can wiggle it on out of there. So look at this, backwards. So you do want to be really careful moving it around. Make sure you get it on correctly. Okay, now I am sterile, so I can touch anything inside of this kit. Rewind. So before we get sterile, we need to loosen our caps. Since I'm already sterile, I would just call another nurse or somebody to come in and help me. Unfortunately, there's no one here to help me. So I would take my gloves off, I would loosen my caps, and I would get re-sterile. So rewind, loosen your caps before you start. Now you can open your kit, get sterile. So now I am sterile, my caps are loosened, which the reason for that is because we want to just take a cap off and be able to pour it in without getting unsterile. The way we're going to do that in this procedure, you will have a dominant hand and a non-dominant hand. Dominant is sterile, non-dominant is not sterile. This is the hand that's going to pour your solutions, and that's going to remove the cannula from the patient. So I'm going to pour my solutions in first. So when using hydrogen peroxide, you always want to have 50% hydrogen peroxide, 50% sterile water. So I'm going to remove my cap, always put the cap up. You're going to do 50% hydrogen peroxide, recap, 50% sterile water. Notice I'm using my left hand, my non-dominant hand. I'm also going to put just sterile water in the other container. So I have one with hydrogen peroxide and one just sterile water. So now I've got some solutions. Let's see what we have in our kit. Easier to do this before you get sterile also. This is our sterile drape. You want to get this over the patient's chest, right under the trach. It just increases your sterile field size that you want right over the patient's trach. Did you notice that I maintained sterility with one hand only? I recommend putting that on prior to getting non-sterile with one hand. In my kit, I have some long Q-tips that we'll use to clean the patient's skin. There's also some pipe cleaners, pipettes, I think they might be called, that you clean to use the inside of the cannula, as well as a brush to use to clean the inside of the inner cannula. Here's that extra tie I was telling you about. And there's also some smaller Q-tips. There's gauze. And then in this gauze is the fenestrated gauze that I was telling you about that you must have to put under the patient's trach once you get them all nice and clean. That we want to keep dry. So now I'm going to go to the patient. The first thing I'm going to do is I'm going to remove the inner cannula and get it in my fluids to start cleaning it. So I'm going to use my non-sterile hand to remove it. And you remove it by just turning it a little bit and pulling it out at the same curvature as the cannula. So this is the inner cannula. You want to do this fast because it's much easier for the patient to breathe with it in. So you drop it into your 50% solution. You take all your cleaning devices and you clean with your sterile hand, touching only the tips of the ends of the cleaning devices. You can go inside. You want to get any thing that's been crusted on here, any secretions, removed. You can also use your pipe cleaners to do the same thing. So once you get that pretty clean, you're going to then dip it into the sterile water to remove the hydrogen peroxide and any other sediments that might be on there. Give it a couple taps on the inside of the container. You don't need to dry it, but make sure that most of the liquids off there is just a little moist. Then when you go to reinsert it, you do the same thing. You follow the insertion of that same curvature of the cannula. You insert and you'll hear it click in place. Once that's in now, the patient is able to breathe easier and we don't need to maintain sterility because now we're not going into the patient's stoma anymore. So we want to remove that fenestrated gauze that's on the patient already. Be really careful when you remove this because sometimes they dry to the patient's stoma. If that was the case, you would want to get some wet gauze and clean around the dirty one before you remove it. So you take some of your gauze. You can put more sterile water onto this if you want. I'm going to use this and we're going to clean, let me get rid of this. We're going to clean around this stoma underneath the cuff. Now, like I said, you need to remove one side only at a time. If you remove both sides, then you must maintain holding this the entire time you're cleaning. So it's easier just to leave one side attached. So clean under and around and grab another one. Same thing, clean under and around. And then you can use the rest of the clean Q-tips to clean even closer to the stoma. You just go under the cuff and really go all the way around and make sure it's nice and clean. Then you'll take another gauze and you're going to pat it dry. You want to make sure, just like with any wound, that you keep it pretty dry and make sure it's less chance for infection and also skin breakdown. So now that it's all nice and clean, we can take our fenestrated gauze and you just apply that so this goes right around the stoma under the cuff to maintain patient skin integrity. So you pull it all the way up and around, and now we want to replace the tie. So while that tie is still attached, you take your new tie and you attach one side before you detach the other side, again, to make sure that at all times one side is attached. These are great. They can be changed to different sizes depending on your patient's circumference of their neck. You want to make sure that that nice padded cushion is on their neck, that the Velcro is not. You go under and around, and now both sides are attached, but one's clean and one's dirty. So you just move their head up a little bit, pull the old one out, and tuck the clean one around. And again, always one side attached. So we're going to decrease. We're going to take off the dirty one. We still have that side attached. And we will pull this under and through and Velcro it around. You want to make sure that you can insert a finger under this. This is a little loose. We don't want it loose. That means the trach could move out. So we're going to tighten this a little bit. So now we should only be able to fit one finger's width underneath to make sure that this will hold the trach in place. At this point now, the patient's trach inner cannula has been cleaned sterilely. The outside of the stoma has been cleaned, dried, and a new gauze in place, as well as a new trach tie. So that means your trach care is complete. You want to make sure that you ask your patient how they're feeling, if they're breathing okay. You'll be able to tell when a patient's not feeling like they can breathe well. At that point, you would maybe want to give them some supplemental oxygen, sit them up a little bit higher if they weren't, assess to make sure that the trach's in place. Then you can clean up all of your cleaning supplies, reposition the patient to comfort, give them their call light, and your trach care is complete.